Hi, everybody. Welcome back to Care Anywhere. This episode, I sat down with Laura Messineo, Chief Nursing Officer for WorldWide HealthStaff Solutions. Laura leads their clinical operations and virtual health initiatives, and we focus today on the topic of telehealth and virtual care, where the capabilities have evolved since the pandemic, how she's seeing the technology support global care access concerns, and how Worldwide is deploying virtual care solutions in the Philippines. We had a great conversation. You won't want to miss it. So stay tuned. This episode starts right now. In this podcast, we're setting the table for some powerful discussions with nurses, allied health professionals, regulators, tech innovators, and other thought leaders across the globe. Welcome to Care Anywhere, the Global Health Workforce Podcast, brought to you by TruMerit. Hi, everybody. Welcome back to Care Anywhere. I'm Lea Sims, host of this podcast. I'm joined today by Laura Messineo with WorldWide HealthStaff Solutions. Laura, welcome to the podcast. Laura is a nurse, Chief Nursing Officer with Worldwide, and she is an expert in telemedicine and virtual health, something very near and dear to my heart and career experience as well. So I'm excited about the conversation we're going to have today about telemedicine and virtual care and the intersection with nursing and the international workforce. So Laura, welcome to the podcast. I'm so glad to have you here.
Thanks for having me, Lea. I'm thrilled to be here.
Wonderful. Well, why don't we start with you telling our audience a little bit about yourself, your background, and the work that you do today. And of course, we'll dive deeper on that later, but just frame this out for us and let everybody know who you are.
Sure. So I'm Laura Messineo, and I've been a registered nurse for 35 years. Currently, right now, I'm the Chief Nursing Officer for WorldWide HealthStaff. We are a direct hire international nursing staffing agency. We bring international nurses to U.S.-based hospitals, and when the nurse arrives in the U.S., they are the employee of the hospital itself. And part of my role here at Worldwide is to be able to help the transition of international nurses to U.S.-based practice, in partnering with our clients, which are hospital systems, to understand what their needs are and making it a blended model of supporting the hospital system and the international nurse. So that's
wonderful
at a high level.
Great. That's a great way to tee us up. We always ask nurses on our podcast sort of this, well, really anyone working in a healthcare role, this framing question at the front end. What inspired you to get into healthcare, to become a nurse, to make this your life's vocation? We get all kinds of great stories about the entry point. No two are the same, but I think they're inspiring to young new up-and-coming healthcare professionals who are either considering the profession or stepping into it and wanting to know what their career opportunities are going to look like. And so that's a big part of this podcast. So how did you get started? What made you want to pursue a career in healthcare?
Well, I always had an extreme focus on taking care of individuals or taking care of pets, like from a very young age. When I was in high school, I started to volunteer at a hospital, and I got to see different things in the hospital setting, and I was just completely intrigued with becoming a nurse. I had a lot of opportunities as far as when I was in high school to see many different aspects of the healthcare delivery system. And I graduated high school at the age of 17. I immediately went on to a 2-year nursing program, and I became a registered nurse at 19. And so I was, I wasn't legal for many things, but I was a registered nurse in the state of Illinois. And my first job out of nursing school was in a large academic medical center in their pediatric intensive care unit. I've always been focused on critical care. My entire career was either in adult or pediatric ICU or cath lab. But about 20 years ago, I got involved in the virtual health space when people said, "What do you mean you're doing something using technology to take care of people? You can't do that." Right. And spent a long time in that space where services weren't being reimbursed. There wasn't legislation to get it approved. There were
cross-state licensure was an issue.
Exactly.
Yeah. Yes. Wonderful. So talk about you've talked a little bit about your early career, and I would say that amount of experience really at the bedside in critical care enabled you to see where technology could be deployed both in acute care, which we saw a lot of in COVID, in terms of in-hospital telehealth, and then obviously the accelerated adoption of that, outside of those core facilities. Um, what led you into the role that you're in today? So how did you move? You touched on, you stepped into virtual care and telehealth. What did that look like in terms of moving out of maybe bedside care and into the deployment of virtual care technologies?
Sure. Well, I frequently say that virtual health, telehealth, telemedicine really is just care delivery.
Yeah.
And when I started in the space, it was in 2003. And I started working in a virtual ICU program. So as far as I looked at it, I was still taking care of patients. I was taking all of my critical thinking skills, all of the years that I had directly taken care of patients, and I was then helping to support bedside nurses from a distance, ensuring that patients receive the highest quality of care and that evidence-based standards were being followed. And I just became enthralled by that model. When I first walked into the virtual ICU department, the manager had said to me at the time that it's like you are a pilot in a cockpit and you are watching everything around you and making sure that everything is being done in the most appropriate manner. And at that time, I really changed the direction of my career. I dedicated the next 20 years to the virtual health space. I was able to stand up over 100 different virtual health programs across my health system prior to the pandemic, which is almost unheard of. There's a handful of people that were early adopters in the industry. And it was about understanding where were the gaps in clinical care delivery within our health system, and whether that be from not having enough of specialty providers or not having enough nursing staff or having poor quality outcomes. I worked with our key stakeholders and then custom developed programs, ensuring that we walked through every clinical workflow. We ensured that we could meet that from a virtual perspective if we needed to embed digital tools into the space so that we could auscultate breath sounds. We did that. And then we held ourselves to the same quality metrics as in-person care and had dashboards built out for both the quality metrics and the financial metrics. And that's really what helped us push programs forward within the health system I was at, because they saw the value it was providing both from quality and financial.
I think we saw, and I know we didn't talk about this in our prep call, but we saw a lot of that begin to turn around prior to COVID with the hospital readmission rule, when the 30-day readmit rule came around and people suddenly began to perk up and say, we need to figure out a way to keep people out of that readmission cycle. And virtual care is really one of the ways we're going to be able to do that if we can pull closer to our patient in their at-home or outpatient environment with remote patient monitoring tools and trackers and those kind of things. Did that have an influence on how you guys were building those programs, really trying to connect the dots there?
It absolutely did. So we worked directly with our home health agency and we deployed remote patient monitoring. We had a centralized team of virtual nurses that supported our patients that were in our home care program in order to keep them at home and reduce the readmission rates. We also had programs built around hospice. We know that when a family is at home with their loved one that's in hospice and in the middle of the night, all of a sudden they're really, really concerned. What better way could you bring a nurse in virtually in order to talk to the family, explain to the family what was happening? So we really looked at all of the pain points and then created programs to close those gaps so that, you know, our patients and our families had a better experience, but yet on the healthcare delivery side, we were closing the gaps on, you know, improving all of the quality metrics and financial metrics. And it was a great opportunity to show how using clinical skills of very seasoned nurses and very seasoned clinicians that you could really provide great value
Yeah,
virtually.
absolutely. I see that moving into hospital-owned programs as well, the deployment of those same capabilities that you're talking about with hospice, because they're moving some of that low acute inpatient care into the home now, which is fascinating use cases for sure. How are you focusing on virtual health in your current role? Because right now you're working for a global staffing agency. You're
I
working with
am.
international health workers who are looking at career mobility options and want to come into health systems that are in either downstream or in mid deployment of these kinds of capabilities and technologies. What are you doing in this role, and how are you helping to prepare those international nurses and other health workers who may never have been exposed to these technologies where they work today, or have had limited experience using them, and are going to be moving into health systems and care settings where either virtual remote monitoring tools are being deployed, data analysis against those tools is expected, all of those things. So I'd love to know, how are you bridging that gap for the candidates that are coming through your doors?
Well, I can share from a variety of ways of how we're supporting candidates, and also I can share some new news about what we're doing.
Wonderful.
Um,
Great.
so, from an international nurse perspective, I do a lot of webinars. So, I've done webinars on virtual health where we talk very specifically about what it is, what sort of skills you need to have. We talk extensively about the fact that most organizations require a minimum of 5 years of bedside experience in that specialty in order to be able to take a role that's from a virtual perspective. And we
Right.
talk about, virtual etiquette and the fact about HIPAA.
Yeah.
Um, and so most of our international nurses have been very engaged from that perspective. And then in addition to that, we are in the midst of standing up virtual health operations in the Philippines to provide services to US-based hospitals. So our first initiative is we are standing up virtual sitter operations. So in the US, we have virtual sitters that are in a centralized site that monitor patients who are at risk for falls, whether they be in an acute care hospital or in the post-acute care environment. The staffing model is a 1 to 12, 1 to 15, depending on the organization.
Right.
And we're finding that just like we have a nursing shortage in the United States, we've had a nursing shortage since I became a nurse. There are also shortages of these entry-level positions where the health systems have technology deployed and they can't utilize it because they do not have a workforce to support it. So our first initiative was to stand up virtual sitter operations, and then our second initiative is really focused on standing up virtual nursing operations, both from an international perspective and then blending it with domestic staffing.
Yeah.
And then moving into the RPM and chronic care management space in the future. So I'm very excited about that opportunity. We're one of the first organizations to stand this up from an international perspective. And I think that it'll provide value to our clinicians that are abroad, and it'll provide great value for US-based health systems.
I love that because it obviously addresses a concern we hear a lot, and I know our the recruiting organizations that we work with that are part of our alliance, which WorldWide is. We do hear a lot of concerns about talent loss and talent flight. I think they're calling it now. We hear about brain drain, right, and the concerns of low to middle income countries who are losing nurses and health workers to migration. Really being able to equip them to provide services virtually and stay in country where they are is an answer in many ways to that problem. It's not necessarily going to be the right path for everyone. There's still going to be nurses and health workers who want to pursue opportunity in other areas of the world. But I really do believe that the deployment of telehealth and remote patient monitoring, both training and setting up the competencies that it takes to deliver that, is one of the ways that we can work with these countries that are struggling to retain their much needed nurses and health workers where they are. And so kudos to you and to Worldwide for really investing and focusing on that there in the Philippines, and where you're going to be, I'm assuming, expanding that program elsewhere. Yeah.
I think there's many reasons why nurses are interested in virtual health. Now, not all nurses are. Some
Right.
nurses really want the physical touch with their patients.
Yeah.
But we have many nurses for a wide variety of reasons that are really enamored and dedicated to the virtual health space. Anything from, someone that's looking to evolve their career and to take the clinical skills they have and the critical thinking skills they have and apply it to a completely new area. So we have some people that are interested from that perspective. We have others that perhaps they're have been in the career a long time, and the physical demands of the on-site care is something that is becoming challenging, and they feel as though this is a way to expand their career and continue their career instead of retiring. We see a lot of nurses that have dedicated themselves to specifically the virtual health space. There is virtual health certifications that are now in place. I remember years ago, we worked with CCRN in order to be able to have a CCRN certification for a virtual ICU nurse, and we were able to achieve that. And there's many departments that are now saying, that are virtual departments, that they want their nurses certified in the specialty area of the service that they're offering. And many hospital systems are mandating it within, 2 years of employment, that they'll receive the certification in whatever the clinical area is.
Yeah, absolutely. So let's talk about the technologies. What kinds of tech are we talking about? Platforms, applications? What are you seeing? How are global nurses acclimating to those technologies? We talked about that before, and training, which is something we're always very focused on, and downstream certification of those things as well globally. What are you seeing out there, and then technically, how do you pull that together?
Yeah, I think from a technology perspective, there are so many different technology platforms that are being explored. I think, the buzzword today is AI,
Right.
which there are some great opportunities in AI. It cannot necessarily be applied to every single clinical setting. We need some additional learnings and validation. But we're finding ways where the tech companies are pushing the needle, which is great, or they're expanding their services. Great example of that is, historically in the virtual health space, there's been a lot of point solutions. This solution only supports this population. And now many of the companies are expanding their services or consolidating or acquiring other companies so that they can really provide a continuum of care where, regardless of the location of a patient, they can use the technology. I think that's something that we're seeing out of all the major vendors in this space. I think the other thing is we're seeing vendors that used to be focused on on-demand visits with patients, a physician or a nurse practitioner to a patient. We're now seeing full primary care behavioral health models blended together, where you have an entire team of clinicians that are supporting that patient through their care journey through many different symptoms or different providers they're seeing. Anything from a nurse doing an initial assessment and then handing off to a physician who hands off to a nutritionist. it's endless as far as how the services are being looked at. I know not only health systems, but health plans are looking to see how can we come up with programs that are going to support from wellness all the way through the care continuum.
Yeah.
I think from a training perspective, one of the biggest things is making sure that all stakeholders are at the table to understand what the process is, getting feedback. And then from a training perspective, it's really leveraging the clinicians' expertise and walking through with them what are the clinical protocols we're following, how do they do this virtually, making sure that they've got enough time for coaching and mentoring before they're eventually allowed to take care of patients on their own, understanding how to troubleshoot or how to get help. I think that's probably some of the biggest lessons I've learned over the years as far as launching them, but just as much as training the virtual clinician is having that deep partnership with the bedside team, because it's not that there's someone watching you or there's a big brother. We're all part of the same team. We're all working for the same reason in order to meet the patient's needs. And I've seen a lot of success when you really have that deep partnership.
Yeah, absolutely. I remember thinking coming through and out of COVID, I was working for Verizon at the time and we were launching Blue Jeans Telehealth. I was part of the team that launched that platform. And one of the things we could see about 2 years, 18 months to 2 years into the pandemic, rapid stand up and deployment of telehealth capabilities everywhere, was that there was still a need for a shift in workflow, still a need to shift practice and care models to better accommodate hybrid and virtual capabilities. It was almost as if you were plugging in that virtual tech in the same patient workflow, in private practice that we'd always seen. And I thought there's so much potential for telemedicine, for virtual care, to actually transform practice models, like to rebuild the mousetrap, so to speak. How would a visit with a patient or the management of a patient look if you built this virtual first, not virtual only, but virtual first? What would that look like? Because it really does change and open up the possibilities of how to use that. And I thought there's a real potential here for the pandemic to have brought about really necessary change in the way we do that, instead of just sort of plugging it into old models. Have you seen that evolve? Virtual care really being able to open up, like you said, it's not always a doctor or the nurse that's talking to the patient. It might be the deployment of that capability for your patients to talk to each other, to build community around disease and treatment, or other ways that it could be positioned. I'd love your thoughts on where you're seeing it evolve, because there was always the risk that it would just be a patch or a Band-Aid to the issues we saw with COVID, and not necessarily evolve in ways that would transform practice, which I was always excited to see. Like, I think this has the ability to really move the needle on some things that probably needed dusting off and changing, right? So.
Absolutely. Well, I think I would agree as far as during the pandemic, right? You had a handful of organizations prior to the pandemic that truly had virtual health strategies and had deployed for many, many years. And then all of a sudden you saw the influx of every organization deploying virtual health. And great things happened during the pandemic and how that helped them close the gaps. But also they were very disparate systems that were launched in order to close the gaps. And so now, fast forward to now, most organizations are redefining their strategy, trying to figure out how do these programs intersect with one another? How can programs be streamlined so that you can get a patient in to see someone and then get handed off to another specialty provider, or go into a class to learn about their knee replacement instead of having to physically go in and do that. You are seeing a lot of virtual first models in the market. Many of them are through the tech companies that offer clinical services too.
Yeah.
And
Yeah.
they're looking for patients to sign up for their primary care physician to be,
Right.
and that's their first step. You would never call anyone.
Like the Amwells of the world.
Exactly. The
Yeah,
Amwell, the
exactly.
Teladoc, the
Teledoc. Yeah, exactly.
Live.
Yeah. Yeah.
Um, but you're also seeing other companies that are really trying to expand services and bring in many different things like diabetic monitoring, right? Not only being able to do urgent care, primary care, behavioral health, diabetic monitoring, hospital at home, remote patient monitoring. And I think some places are doing it well. Some, it's still a journey. I don't
Yeah.
think anyone's quite where they want to be yet, but
I think the integration of all those things is it was the challenge, right? It's not the
exactly
vision. I think it's
right.
how do we get that real-time remote patient monitoring data? Can I pull that up while I'm talking virtually to my patient, go over the latest data? Is it integrated into, Epic
Right.
or my Cerner system or whatever? And all of that, the dream is that it would happen seamlessly, but I think that's where the struggle has been, is how do we stitch all of that together? And like you said, there's been so many disparate standalone solutions that the real integration and interoperability, of course, is always, I think, kind of the thing that the sludge people kind of have to wade through to get that dream to reality, because it's not the idea behind it. It's really kind of the technical roadmap to get there, the
It is.
architectural roadmap to get there, right? It's more difficult than
It
it
is.
looks, but there are certainly some people out there solving for it. How are you saying? We didn't even talking about this, but I'm curious how you're seeing the reimbursement issue evolve, because I know there was, when there were the temporary waivers during the public emergency period, there was a lot of reimbursement around that, and then some of those things closed. There's still a lot of advocacy around seeing those reimbursement decisions made permanent. I follow what ATA is doing along those lines in terms of advocacy. Are you seeing that change? Because that's always, prior to the pandemic, that was a real
Oh,
roadblock.
it was
Um,
an extreme roadblock.
yeah,
When I was in Illinois managing virtual health operations, we were able to work with the Illinois government in order to get waivers and in order to get policies that were approved across the state.
yeah,
When we were there, we were one of the last states to be able to have telepsychiatry reimbursed.
nice.
And
Yeah,
it took a lot to be able to
yeah,
work with the local government in order to get that approved. I will say I did work for a health plan for a little bit, and it became part of their payment model. And the stance really was, if you could achieve the same standards in the virtual health space that you could in person, they would reimburse for those services. But there still has to be a lot done at the federal level where, just to hardwire it that virtual health will be reimbursed, will continue to be reimbursed.
yeah.
I'll say, from just being a person that consumes healthcare services, my insurance plan offers me a virtual option, and
Yeah,
so
mine too. Yeah,
we're seeing that, and I think it's just a matter of time before all the great work that ATA is doing really is going to put us down a path where there'll be consistent reimbursement for virtual
I
health
do think
services.
the health plans really sort of woke up to the fact and paid attention to through the pandemic that not only do patients really have more of an affinity for telehealth than people thought they would. There's certainly a sliver of people who aren't going to be satisfied with it, always need to go into a doctor's office and have to be physically seen. Just as there are patients that a physician would say, I need to see you in my
See
office. We
you.
can't do this virtually, right? But I think there was such
Yeah.
an affinity for it and a lot of public satisfaction with it that health plans have moved towards, adopting that and delivering it. I just was curious on the provider side, if they have been as satisfied with the progress that's being made on their reimbursements. And I know that a lot of it was around reimbursement parity, not necessarily equity, because that's not the same thing. Like you said, the pushback is if you can show me that you're delivering the same standard of care that you would in office, then there's a parity of reimbursement we can talk about. And I know that's been a big issue, but in the last couple of years of being here, I haven't been as plugged into it as I was in the past. And so I was curious if you were seeing some growth and evolution there on the reimbursement side, because I know
Yeah,
that was a barrier for a while.
I think there's been some growth from that perspective as far as reimbursement at parity. Certain organizations, not all
Yeah.
organizations are doing that. But I also think what has happened for a long time, providers did not embrace virtual health for a variety of reasons, whether they didn't have a technology or they didn't understand
Right.
the standards in the space, or they were afraid that their patients were going to be taken away to go to an online provider. And I think what happened during the pandemic is that there were providers that had tools that they could utilize and then directly saw the value it would provide them and the patient.
Right.
I had a primary care physician for years, and every time I would go in to see him for a physical, I'd be like, "Are you doing? I need virtual." And I would never do virtual. I can't even imagine doing virtual. And well, post pandemic, he still has it embedded in his practice. He loves it. He now does a day from home every week and does his virtual visits. And so it's really providing value to the patients where they can be seen when it's convenient in the location that they're in. They don't have to leave work.
Right.
They don't have to leave home if maybe they don't have transportation. But it's also giving our providers some work-life balance. So
Yes.
it's a win.
I think once they were able to try it and work with the technology, some of it's just fear of the unknown. I know a few physicians in my
Right.
own circle who had the same resistance to it in the beginning, and now they couldn't live without it. They love it, and love the flexibility and the option. But like I said, I also think there's great potential to rethink for a private practice or general practice, rethink how your patient engagement, your relationship building with your patient could change. What would it look like if your patient had a once a month scheduled virtual visit with you
Right.
where you could just check in on them and see how they're doing? And
Yeah.
we weren't in this model of call me if there are any problems with
Right.
your with your medication, because that I think there was a concern in the beginning that virtual care would actually disrupt the physician patient
Correct.
relationship.
Yeah.
And when I was at Verizon, we had a lot of patient feedback that said, actually, I think my relationship with my provider is better.
Yeah.
He's not head down in his laptop, plugging into the EHR. He's looking at me. He's engaged. We're talking, he or she. Um,
Right.
and we're talking more often that way. And I actually feel a better engagement with my clinician through virtual care. And so I think there's a potential to even restore that patient clinician relationship through
That's
regular virtual visits. But yeah.
absolutely. I mean, I love that we have the ability to send a message to our provider and
Yes.
you get an email back, and
Yep.
it gives, or you go back into the app and you see the response from your provider. I mean, isn't it great? You don't have to pick up the phone and
Yeah,
wait on
absolutely.
hold or wait hours for a provider to call you back. And at the same time, it's giving that provider some work-life balance where on a break, they can go in and answer some messages. And I think it's actually creating a better relationship with your provider because you feel as though they're really responding
Yeah.
to what you need. And if you need to come in, they're going to get you in, or they're going to say, hey, I'll do a virtual visit with you. We can do this virtually.
You're not out of sight, out of mind until the next
Correct.
visit, 3 months from now or 6 months from now, which is great. I also have to say it's a benefit if you're a caregiver to someone.
Yes.
I know the ability to get into my father's my chart last year when I was caring for him. He passed away of Parkinson's last year, and
Oh,
probably thank you, for the previous year or so prior to that, really managing a lot of his care decisions or working with my stepmom to do that. And I loved the ability to get into his my chart and see his test results and communicate with his physicians that way. And they were always so responsive, and it was a tether to his care providers in a way that
yeah.
I don't think without virtual care we would have
No.
that ability.
Mm-mm.
You would still be
Agree.
picking up the phone, and you'd have to go through that front end gatekeeper to schedule an appointment and come
Hmm.
in. You might get a call back, but yeah, virtual technology I think has really enabled that greatly. So I don't think we had planned to talk about all that, but I do love it. I'd love to pivot back to one of the things I would say is a lot of people think of telehealth or telemedicine as just virtual visits, but there's a lot of virtual technology out there that's tied to teleradiology, for example,
Right.
and that's enabling. We didn't even talk about, and we could, how telehealth is enabling what it was originally envisioned to enable, which is care access for patient populations that don't live within, can't get to, walk to, drive to a care facility or a health hub. Virtual care is really supportive of that, and tremendously globally we're seeing it, specifically telestroke, remote patient monitoring, which is every kind of device that could possibly be attached to you, and monitor, or inside you in the case
Yeah.
of an adjustable. There's so many of those we could talk about. What are you seeing that's sort of cutting edge, that's new in that space, that maybe people generally don't know about?
Well, like I mentioned before, I think AI is disrupting the space now and coming up with new models. But I also think a lot of the devices that, like the Aura rings, that are
That
now,
one.
giving data,
Yeah,
or our Apple Watches, and we can embed them into our EMR so our provider can see exactly what
yeah,
we're doing. I think that the AI is probably the biggest new thing that's disrupting care. It's also allowing um, uh, services to be scaled.
yeah.
So it's taking a few to thousands, right? Instead of smaller models. I think that's what we're seeing.
It
I
was
also
really
think,
needed too, the
yeah.
AI. I mean,
Oh,
not only is it gonna, propel telehealth into its next, generation, but I it we would hear, hey, we'd ask our clients with, remote patient monitoring devices, which we were enabling at Verizon with
mhm,
cellular technology, as you can imagine, like, "What are you doing with all that data?" They're
right.
like, we're collecting a lot of data, but we don't know what to do with it. We
Yeah.
don't. And I would ask them, what analytics are you running on that data? What insights are you? I mean, are you leveraging it for patient care? And I think in the beginning, they they were just sending people home with these remote monitoring devices, sometimes
Yeah.
at discharge from the hospital, and the data would go to a third party,
Right.
alerting process, and they might get alerts here and there. But if AI has now come along and pulled alongside those monitoring tools, to me that was always the missing gap, is that if I'm a clinician, I don't have the bandwidth to do that kind of analysis
Right.
on all that data, and the AI can really do that for me and extrapolate
Right.
really meaningful real-time insights that can inform care and treatment. And so I think that's been a critical thing to see come along and layer into that whole process for sure.
Absolutely. I mean, the ability to take visual color coded alerts to alert a clinician instead of them having to go into every single chart to figure out what's going on, or looking at every
Yeah,
single patient. It is creating some healthcare efficiencies also. I think another big thing that we've seen is the adoption of virtual nursing. There have been a lot of pilots, there's been a lot of work done in this space, but we're seeing health systems now deploying it across the continuum of how can we take some of the workload off the bedside nurses that is more so administrative documentation, and how can we take that in make efficiencies for these nurses. I think that that's really incredible. And I think those models are evolving where you perhaps have a virtual nurse that's seeing a patient in the acute care setting, and then they're discharged home, and that nurse takes care of them there too. You're taking all that information that that clinician knew about that patient, and it's across the continuum now, rather than just, while they're in the hospital for 3 days. I also, some other things that are happening is ambient listening. So a lot of organizations are starting to use ambient listening, where the nurse's clinical documentation is done off of that, and they're doing it in pilots and expanding it. So I think that is going to revolutionize the healthcare delivery model, because if ambient listening can document into an electronic medical record, regardless if it's a nurse or a physician, that is going to streamline the processes at the hospital and create efficiencies.
Yeah, absolutely. I had that conversation with Kathleen McGraw, who's the CNIO for Microsoft, and we were talking about how they're rolling out Copilot and the role, the easier adoption they're finding in health systems where their nurses have already moved to narrative care in some format, and they're more AI voice, ambient voice ready because of that. And internally, we've been talking about how that ties in terms of international workforce to the importance of English language proficiency for our, our international candidates who are coming in. Obviously, they have to go through ELP testing and all of that. Come in. It's in their best interest. It's certainly in the patient's best interest in collaborative care. But increasingly now, one of the other things we're adding into that narrative is it will make you more tech ready. So it's important to move from proficiency to mastery, because you may be stepping into one of these health systems or hospitals that's putting a Copilot enabled ambient voice or some other AI tool in there. And the more readily you can move into a narrative care format, the more tech ready you'll be to do that. So that's probably a whole other discussion we could have. But
at WorldWide, we're really trying to support the nurses from an English language proficiency. We know that, they have to pass an English language exam of reading, writing, and comprehension. But when they come to the United States, and perhaps they start at a position at a health system, sometimes they have some challenges. And we now have a team of English success coaches that help support them, either doing one-on-one coaching or group classes while they're here in the United States and starting their orientation, just to reinforce and help them be more successful if they're having challenges, which I think it's so important. We know that any international nurse that is coming to the United States has waited such a long time to come here, and we want to set them up for success.
Yes, we want to see them thrive, when they get here. Which is one of the reasons why I brought that up. That tech enablement, tech readiness is just yet another reason to really embrace that journey.
I will share. I was recently in the Philippines, and I was able to tour 2 very distinct hospitals. And prior to going to the Philippines, there was this, thought that in the Philippines, they don't have an electronic medical record. I walked into the only magnet hospital in the Philippines, and they have an EMR. It was nicer than any U.S. hospital I've been in, very robust clinical protocols. And I think, what I've learned in the process is that there are differences in every country of what technology exists. Some are more advanced than the United States, some are not. But it's really understanding what is the clinician's strengths and weaknesses related to technology, and then really being able to help support them from a technology perspective, and how can we educate them a little bit on the technology they're going to see, and then worldwide, we work with the hospital systems to help them customize their orientation program to really support that international nurse
Wow,
with the
that
technology.
transition to practice piece is so
Right?
important. So important. Well, we are at the end of our time, actually overtime. This has been a great discussion. I've loved every minute of it. Laura, thank you so much for joining me today, sharing your expertise, the many years that you've been a pioneer, really, helping to shape and drive the future of telehealth. Having been connected to that closely myself, I know how much of an uphill boulder that has been to push for the pioneers in that space who've been trying to get it out there. Congratulations to you on all of the work that you've done and the work that you're doing with Worldwide, and appreciate your time today so much. Thank you.
Thank you so much. I truly enjoyed being on with you and greatly appreciate the opportunity.
Absolutely. Thank you so much. All right, everybody, that's the end of this episode. We hope you'll join us back next time on Care Anywhere. That's it for this episode of Care Anywhere. Thanks for joining us. We hope you'll tune in for future episodes where we will continue these powerful discussions about our global health workforce. If you missed any episodes, you can find them at trumerit.org/podcast or by subscribing to our channel on your favorite podcast platform. Just look for our podcast logo or search for Care Anywhere to find us. Thanks again, and we'll see you next time.